Good morning. As a preliminary matter, this is Stephen Vigent, Chairman of the Shrewsbury Board of Health. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jenny Fishman?
Here.
Dr. George Abraham?
Here.
Staff, when I call your name, please respond in the affirmative. Kerry Stockwell?
Affirmative.
Anticipated speakers on the agenda, please respond in the affirmative. Julie Van Arsdalen, CMR, PHA.
Affirmative.
Micah Blondeau, same.
Affirmative.
Sarah Ting and Associates.
Affirmative.
Brian Moss, 16 Ruthin Circle.
Affirmative.
Okay, good morning, everyone. This open meeting of the Shrewsbury Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, the Shrewsbury Board of Health is convening by telephone by dialing 1-617-675-4444 and entering the following PIN number, 500-143-722-2597 #, as posted on the town's website, identifying how the public may join. We're now turning to the first item on the agenda, but before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I, the chair, will introduce each board member or staff member who has the lead role for this particular item or guest speaker associated with this item on the agenda. After they conclude their remarks, the chair will go down the line of members first, and then to staff members, inviting each by name to provide any comments or questions. I will then call upon the members to offer a motion and then for a second. Please hold until your name is called. Further, please remember to mute and unmute your phone by pressing *6 or mute your computer when you are not speaking so as to trigger your camera feed or background noise. After members have spoken, the chair will afford public comment as follows. The chair will first ask members of the public who wish to speak to identify their names and addresses only. Once the chair has a list of all public commentators, I will call on each by name and afford 3 minutes for any comments. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in colloquy with other members, please do so through the chair, taking care to identify yourself. Finally, each vote taken in this meeting will be conducted by roll call. Okay, this meeting of the Board of Health is being held on Friday, February 26, 2021 at 8 a.m. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 20A, Section 18, and the Governor's March 15, 2020 order, imposing strict limitations on the number of people that may gather in one place. This meeting of the Shrewsbury Board of Health will be conducted via remote participation to the greatest extent possible. To participate in the public comment portion of this public meeting, please dial 1-617-675-4444 and enter the following PIN, 500-143-722-2597 #. Please mute your device until the chair of the board addresses this agenda item or opens the meeting to public comment. So I'm now calling the meeting to order. The first item on the agenda is the review and approval of minutes from the January 29th, 2021 public hearing. Do I have a motion to approve?
I motion to approve.
Second.
Okay, all in favor signify by saying aye. Jenny Fishman?
Aye.
Dr. Abraham?
Aye.
Steve Vigent, aye. So the meetings are approved. The next item is the review and approval of minutes from the January 29th, 2021 Board of Health meeting. Do I have a motion to approve?
So moved.
I second.
Okay, all in favor signify by saying aye. Jenny Fishman,
Aye.
Dr. Abraham,
Aye.
Steve Vigent, aye. So the minutes are approved. The next item is to review and act on proposed updates to Shrewsbury's rule and regulation for body art establishments and body art practitioners. Carrie, I assume that there were no written comments submitted on this amended regulation?
There were not.
Okay, unless there are any further questions or comments, do I have a motion to approve the updated rules and regulations for body art establishments and body art practitioners?
So moved.
I second.
Okay, all in favor signify by saying aye. Jenny Fishman,
Aye.
Dr. Abraham,
Aye.
Steve Vigent, aye. So the amended rules are approved. The next item is to review and discuss tools to assist communities with addressing racism, requested by Sarah Ting of World Unity, Inc. Sarah, would you like to make some comments?
Yes, well, first of all, good morning again, and thank you very much for giving me the opportunity to speak with you and your colleagues. And I really just want to applaud your organization and your community for acknowledging that racism is a public health crisis. I don't know if you're aware of it, but 50 mayors across the nation and 30 states have declared racism a public health crisis. I think it's a very important first step to take. As the saying goes, you can't solve a problem unless you're first willing to acknowledge the problem. And I also want to applaud you for the very important work you're doing right now to help your community get through the pandemic. I know it's been very, very difficult for many, many communities, and they all face different challenges. And you're kind of in a leadership role, so I just want to applaud you for the work that you're doing for your community. I want to begin this presentation with a quote by Mother Teresa that I came across many years ago, and it literally kind of jumped off the page for me. And as you know, she won the Nobel Peace Prize. She said, "I've come to realize over the years that being unwanted is the worst disease any human being can experience. A person can be made to feel unwanted just by a look or even a comment. I think that we don't fully understand and grasp the mental and physical health that discrimination can take on a human being. And unfortunately, laws and policies cannot remove prejudice and biases from people. The work has to be done by each of us individually. World Unique, we've been around for 27 years right now, and our whole mission is about promoting equality, diversity, and inclusion by raising self-awareness through the Sun poem and empowering people through the arts, education, and innovative ideas. The Sun poem is in the PSA, and our wonderful governor actually wrote us a letter supporting the work we're doing, but also acknowledging the poem to raise self-awareness to promote equality, diversity, and inclusion. Our Boston City Council actually passed a resolution back in 2018, recognizing the poem as a powerful tool to help all of us overcome our biases and unconscious biases and see our common humanity. The poem reads as follows. It says, "Are you greater than the sun that shines on everyone? Black, brown, yellow, red, and white. The sun does not discriminate." So that poem opens up the PSA, and the PSA continues and says, "Laws and policies cannot remove prejudice and biases from people's hearts. The Sun poem can open the mind, teach us humility and forgiveness so we can create a better world for the next generation." What we are bringing to your community and consideration is allowing this PSA to be made available at your city hall for employees to reflect upon, whether daily, weekly, as a tool to cultivate a mindset of valuing differences. We all have what's called unconscious biases. All human beings have it. And in order to help minimize unconscious biases, we need tools, simple tools to help us think about how we're treating one another. And in light of the fact that 30 years ago, social media and the internet did not exist, and now it's operating 24/7. And we all know that, unfortunately, there's a lot of bad information going out that can pollute our minds and just put bad thoughts into our heads. I think we need to think about, as a society, what tools we can give our community and our colleagues to, again, cultivate a mindset of valuing one another. The other tool that I think would be very helpful is we have a video of 800 children singing this beautiful song about equality and performing the verse in sign language. I think that could also be a really simple, powerful tool to kind of open up our minds and hearts to see how we're valuing ourselves and each other. So these are like simple tools, and they're free. So you don't have to be concerned about any kind of budget issue. They've been proven to be highly effective. Individuals have told us how the poem opened their mind and actually taught them humility and taught them forgiveness. And forgiveness is an important quality because for those of us who experience any kind of bias, whether it's micro inequity, we do have to have the capacity to learn how to forgive each other so that we don't become like angry and bitter. So those are kind of my immediate points about what it is we'd like to bring to you and share with you. And I welcome any questions that you have about these tools. I do also have some other tools, some simple books that I can also send to you later on for your committee to review. But I welcome any comments or questions with the information I presented so far.
Okay, thank you, Sarah. Are there any questions from the board?
Mr. Chair, just a clarification. What exactly is Ms. Ting request to put up the PSA in the City Hall? Is that your specific request, or is there something more? I wasn't exactly clear.
Yeah, thank you for the question. To make the PSA available on any kind of digital platform you have, and I'm happy to email you an example, like the North America Association for Environmental Education, we sent them our tools, and they right away put it up as resource tools. So on any kind of digital platform that you may have. Now, if you have digital billboards, the poem can easily be put up there as well. So I hope, did I answer your question, Dr. Abraham?
Yes, thank you very much. And Mr. Chair, just a request of Ms. Ting that if she could forward us the materials, that would be nice to review as well before we take a final decision one way or another, just so we could ensure the material is quality and the content is superb. I would have no concerns, but just to be able to look at where it might be most feasible to display would be a consideration. And Ms. Ting, thank you for your work and for the mission you promote. I've actually worked with Mother Teresa's Missionaries of Charity for many years, so I do know Mother Teresa, I did know Mother Teresa, the late Mother Teresa, Saint Teresa, as she's now called. And yes, their work is exemplary, so thank you for modeling that in the work you do.
Oh, you're welcome. And Dr. Abraham, thank you for bringing that up, because this is an idea that I have been presenting to healthcare organizations. I think Mother Teresa's quote is a very powerful quote. And I would really, really recommend that that quote be shared by many, many healthcare institutions, be displayed somewhere, because I really do believe it can just give us a deeper understanding of the profound impact discrimination can have on people, which I don't think we really fully understand and fully grasp.
So Dr. Abraham, thank you. I agree that it would be good to actually review any materials that Sarah would like to send us before making any decisions. And also, Kerry, I would also like, do you know if we would need to run this by the manager's office before going on the town website?
Yes, yeah, and there's also a dedicated group that I believe Jenny Fishman is part of with this effort in bringing recognition to this very important topic. So yes, I absolutely would engage the town manager's office, and they would subsequently have that reviewed by the Board of Selectmen as well. Thank you.
Ms. Ting, I would be interested to know, thank you for joining us today. What other communities in Massachusetts are doing this?
Oh,
And
well,
are they utilizing your materials?
sure. So we've been targeting right now schools with our program called Singing Equality Across America and Around the World. So this video that I mentioned to you with the 800 children singing the song, to date, about over 78 school districts across the nation have shared the song, the program, Singing Equality Across America Around the World, with their music teachers. The mayor of Manchester, New Hampshire, in one day recommended that the program be implemented in all the schools throughout Manchester, all the schools. And they recently had a district-wide virtual meeting, and the teacher who back in 2016 was so moved by the song, she taught and produced a video of 429 children singing the song and performing it in sign language as they sing. And she was the one who brought up the poem and the song, so that by the end of that meeting, they are now going to plan on having an event. And I don't know how they're going to do it, but they're going to have all the children in the entire school district perform the song. The PSA, we have been sharing that across the nation to media outlets. It's only been recent that we've been now targeting healthcare organizations. And the reason why? Well, now we don't have to convince people anymore that racism is still a problem. Now it's been declared a public health crisis. So it's been easier for us to garner people's attention. So that part, the PSA and recommending this be utilized as a tool, has only been recently. And as I said, the North America Environmental Education Association, when we sent the material to them, it was, I think, an hour. It took them an hour. And then they put, and I will email you the link so you can see how they are sharing it as resource tools to their community. We are now reaching out specifically to healthcare organizations and to communities such as yours who have declared racism a public health crisis. So does that answer your question?
It does, thank you.
You're welcome.
Okay, well, thank you very much, Sarah, for coming today. And we look forward to reviewing the materials and then, moving forward.
Yeah, and Stephen, I also, and to the commissioners, I really also want to thank Carrie. She was really great. She took the time to listen to what I wanted to present to you, and she acted on it right away. I cannot tell you how blessed you are to have someone like her working with you. I've been calling across the nation for the last several years, actually for the last 10 years. She is a blessing to you, and I really applaud each of you for taking the time to listen, because in order to solve any problem, what you're doing right now is the first step, taking the time to listen with an open mind and open heart. If we cannot do this, then it's going to be very difficult to solve all these big challenges we have ahead of us. And I also really want to stress for all of us to be mindful that social media and the internet did not exist 30 years ago. It is operating 24/7, 24/7, promoting stereotypes, bigotry, intolerance for differences, misogyny. It's operating 24/7. The only way I can help people understand the point that I'm trying to make, I had posed 2 questions to 2 young people, millennials, who worked at 2 major banks. And I asked them the first question: when was the last time you saw a tweet, a blog, a video, or a website that bullied, denigrated, discriminated either one person or different groups of people. The young lady said, "Oh, I saw something like that 20 minutes ago." The young man said, "Oh, I saw something like that yesterday." My second question, well, when was the last time you saw a public service announcement that addressed all forms of discrimination, all of them, in a transformative way? Their answer, never, until I met you, Sarah. That to me speaks volumes. And so, again, I applaud you for the work that you're doing to really address the healthcare in your community. And I stress we just need to find ways to work together, because we've got big, big challenges ahead of us that will not, there is no vaccine to remove prejudice and biases. It doesn't exist. And when we get the coronavirus under control, prejudice and biases will still be here with us.
Well, thank you again, Sarah. We definitely do appreciate Kerry and everything she does for us. So thank you again for coming on today.
Oh, you're very welcome. Thank you. And I wish you continued success in all that you do. And, you know, Dr. Abraham, I know you have a lot to do. It's not easy work. And so I just wish you success in all that you're doing and working together to help your community.
Thank you, Sarah.
Very good.
Yes,
Thank you
thank
very
you,
much.
Sarah. We appreciate it.
You're welcome.
Thank you very much. Okay, so we'll now move on to the next agenda item, which is review and discuss new information linked to reduced IQ in children requested by Brian Moss, 16 Ruthin Circle, Shrewsbury. Brian?
Great, thanks, Steve. I have a presentation to share to make it easier. In order to share, I didn't use Google Meet. I just have to allow it to. Uh-oh, let me see. Sorry about this. I usually use Zoom, so please forgive me for. Maybe I can do this. Anything?
Yeah, it's there.
Can you see?
Yes.
Okay. Can you see the blue presentation?
Yes.
Okay,
Yes.
wonderful. All right. Well, I just want thank you very much for allowing me to come in and present. I created this PowerPoint and put some time into this PowerPoint to make sure we could have some time to, be able to look at what I'm going to present. So I'm not going to read all this, but I am going to provide this PowerPoint because I wanted to put everything kind of in one place to help you see all the information that I have. And this is kind of the history in Shrewsbury, running from 1952 when town meeting voted in favor of funding fluoridation equipment to 2015 when it first started, when I sent a letter in requesting the Board of Health to suspend fluoridation, given the recent findings at that time that fluoride in drinking water was neurotoxic and endocrine disrupting. There was a bunch of citizens petitions, and most recently, in 2019, there was a request to notify pregnant women about the latest study on fluoride's linked to the reduced IQ in children. And then even more recent than that was the request for the town to provide evidence that swallowing fluoride is safe for pregnant women and their fetus. So that's some of the history. One of the things I wanted to share with you today, I don't know how many of you are familiar with the Toxic Substances Control Act lawsuit. It was a lawsuit that's actually been going on since pretty much 2016. And why that's important is I know the way we left it with, trying to get evidence that swallowing fluoride was safe for pregnant women. I believe the board had decided, had voted not to do that. And, that I could go out and kind of query the regulatory bodies myself to try to get that information. Well, where this comes in is there's actually a lawsuit where all of these agencies were under oath and were questioned under oath. And there's a lot of information that we can now say that is in the trial record that is relevant to our discussion. So this is a very important update where in 2016, there was a group of nonprofits like Food and Water Watch and Fluoride Action Network, and I think there was some individuals that petitioned the EPA in 2016 to end the addition of fluoridation chemicals to drinking water due to the fluoride's neurotoxicity. And that's important because TSCA actually allows you to do it for a specific use. So you can say, if this use of the substance, you don't have to ban fluoride everywhere. You just, you pick a use of it and say, does this use pose an unreasonable risk? And if it does, then they're duty bound to, to do something to mitigate that risk. But in 2017, the EPA rejected the petition. And in response, if they reject the petition, you can sue the EPA in federal court. And actually, from 2017 till June 2020, when the 2-week trial was actually held in federal court, there was a lot of depositions and back and forth. The EPA tried to dismiss the trial many times, but they were denied. And so they finally made it to the 2-week trial in June of 2020. So that was the EPA defending in court its position on this. What happened was very interesting was, and actually I was able to watch, it was via Zoom, so I was able to watch it. And one thing to note was that the judge didn't come out and just vote on either side. So this is very important. The judge didn't say, no, fluoride's obviously safe and effective. There's no questions that need to be asked, and rule in favor of the EPA. Nor did it rule in favor of the petitioners because there was some questions on standing. So what he did was, and I'm going to show some of this information a little later, was he did say that at the time of there was a lot of studies that I've been presenting to you, those NIH funded studies that have happened since the petition in 2016, and those studies, people, you'll see later on that they believe that there was significant evidence and serious evidence in that the judge felt the EPA should consider in its petition that it didn't consider at the time. So he had in November 2020, he had the plaintiffs refile the petition with the EPA, requesting that the EPA reconsider its earlier denial in light of the new information. And so the judge is still yet to make his ruling. He is waiting for the NTP report as well. So you can see here that they included pretty much the NIH funded studies that I was presenting to you is now included in that petition, as well as the revised draft monograph from the National Toxicity Program. He has not yet made, so I believe that's coming out soon, another draft report of that. Just checking, everybody, can everybody still hear me? Carrie?
Yes.
Okay.
Yes.
Thank you.
Thank you.
So what's interesting is, I'm not going to go through this slide, but this is a summary slide of the admissions that were captured during the lawsuit. And this is where I think we for the first time, we actually get to, it's a lot different when you have, I'll say, marketing materials or different things, or, you get different statements where, summary statements, but when you actually look at whether they're proclamations of science, such as safe and effective, right? So if we hear a lot of the CDC and others saying that fluoridation is safe and effective, but we really want to understand what data they have to support that. And that's one of the things I had asked before, is to try to get that proof, right? If we're forced to drink fluoride in the water, at least we should have the proof, because really we should be basing our decisions on science. So we wanted to see that science, and here we're going to get it actually right from the CDC's representatives, and these CDC representatives represent the CDC on these subjects in court. So they do represent in its entirety in these. So you're going to see a lot of quotes that I'm going to do. So if we look at the first one, and I'm kind of going to try to walk through this and how it relates to my question around fluoride exposure to susceptible subpopulations, like pregnant women, where they are forced to drink the water through the water supply. So if you look at the EPA, they did admit that fluoride gets into the fetal brain. So this was, if you look in the court records, there is, and they have like they have to agree on undisputed facts ahead of time. And the EPA agreed that fluoride passes through the placenta and gets into the fetal brain. That doesn't say it's harmful yet, but I don't know if anybody knew that is the science-based process is that putting fluoride into the water and pregnant women drink the fluoride, that fluoride will get into the fetal brain. So that was established. Whether there's other questions on what the risk it poses, but I don't know if anybody knew that is, the EPA admits that. Then we had the CDC. The CDC, the director of Oral Health Division of the CDC, Casey Hannon, he also admitted that fluoride interferes with the brain. So this is the actual, and it's difficult because with the trial going on, you have to, there's no real way to, it's hard to present the information, but this is actually a snippet from the actual transcript from the deposition. So he was deposed under oath. And the question was, so CDC agrees with NRC that it's apparent that fluoride have the ability to interfere with the functions of the brain and the body by direct and indirect means. Answer, yes. CDC in connection with the Intergovernmental Working Group. So you can see there the CDC admits that the fluoride does have the ability to interfere with the functions of the brain. Also, CDC admitted that fluoride is an endocrine disruptor. So question, okay, so CDC accepts that fluoride is an endocrine disruptor. Answer, yes. I'm sorry, answer. We accept the NRC report as a summary of the hazard. Yes. So they are confirming that as fact. I'm going to go through a couple of agencies here. They did admit that the safe dose for fluoride is not yet known for the brain and thyroid. So when you hear that fluoride is safe and effective, and you try to look at what science that statement is based off of, what science are they using to make that statement? We're talking about the brain, but also the thyroid. Question, so CDC does not have any data on the tolerable upper fluoride intake for neurotoxic effects on children. Answer, right. So they don't have any data. So the question is, it's not like they have 5 studies, 100 studies, 1 study. They have zero studies, no data on the upper level. So they don't know the safe level. The EPA was also deposed. I think this was in writing where they did it. So the petitioners asked, identify all primary studies that EPA is aware of which demonstrate or support the thyroid safety of fluoridated water. EPA responds that it is not currently aware of any studies that demonstrate or support the absence of detectable adverse effects on the thyroid. That means they have 0 studies that demonstrate the safety of fluoride's effect on the thyroid. The FDA. The FDA has not conducted or sponsored independent research concerning the risk of neurotoxicity associated with exposure to fluoride and does not have in its possession any internal scientific evidence concerning this topic. The FDA has no position on this topic. So you can't go to the FDA when it comes to this. They're just like kind of punting that. They're saying we're not responsible. But they don't have any information. So now we kind of laid out that. One thing that's part of the safety part, right? They've already admitted that for fact that there is no studies that show the safety of this when it comes to the brain and thyroid. But when you look at the effectiveness part, we have to look at specifically when we're talking, my request where we talk about pregnant women and the fetus, you have to kind of, there's always a risk benefit, right? And right now they're saying that fluoride in the water is good for everybody and it's safe for everybody, right? That would be the only way you could put it in the water. But the CDC admits that there are no benefits from prenatal and neonatal exposure to fluoridated water. So the CDC's conclusion in 2001 is that they had good evidence, high quality evidence to show that fluoride supplements do not provide a benefit for children when given during pregnancy, correct? Answer, yeah, when given to pregnant women. So another way to say that, these are snapshots. There were full depositions, but these are just examples to kind of try to give you. There are a lot more, but can't really pull that all together for you. But this is something that would justify more looking into more statements, such as he also said, we have not found evidence that shows benefit to the child if community water fluoridation or some other form of fluoride is ingested by the mother. This is huge because now you're saying that there is no benefit to the child. So they're ingesting fluoride, and you see that it makes it into the fetal brain. So they're taking all the risk but get no benefit. The EPA, they also had the animals. They also admitted that animal studies point to fluoride risks in humans. Now, Dr. Chris Thayer is the director of EPA's Chemical and Pollution Assessment Division. When she was deposed, question, and based on the animal studies on fluoride neurotoxicity that you have reviewed, you agree that the animal data supports the biological plausibility of fluoride causing neurotoxic effect in humans, correct? Answer, yes. So the EPA is saying so I'm showing you that these same agencies are telling us that this isn't a far-fetched concept, right? That there's neurotoxic effect. They're admitting that there either is or that there is evidence that shows the plausibility of it. Now this one is a very important one because this woman is Dr. Joyce Donahue. She's the chief scientist on fluoride at the EPA's Office of Water. And she's admitted that the NIH-funded studies that I provided you in my requests recently were well conducted and warrant a reassessment of all existing fluoride standards. That's a huge statement. These studies are not off-to-the-side studies. Their own chief scientist is saying that these studies were well conducted and justify the reassessment of the standard. Currently, Shrewsbury used to have 1.0 parts per million in its water, and recently, a couple of years ago, when it lowered it to 0.7. So those standards she's saying, need to be reassessed based on this new evidence, scientific evidence. So question, and you would agree that this study further, and when I say this study, they were talking about, I think there were 4 studies of the NIH studies, and this was on one of them. And you would agree that this study further supports the need for reassessment of current safety standards of fluoride in the United States? Answer, yes, it is one of several. So she's actually saying that what is now the standard needs to be reassessed based on the new evidence. Now, I'm getting near the end. I think I have like one more. So at the end of the 2-week trial, something very interesting happened where Judge Chen, who presided over the federal trial, he had heard both sides, but with both sides, he did say that the NIH-funded studies were the best methodology, rigorous, and best available scientific evidence. Now, why did he say that? He's not just saying that because he believes that. He's saying, I'll do the quote, "So much has changed since the petition that was filed, which was in 2016. 2 significant series of studies, respective cohort studies, which were the NIH-funded studies from Mexico and Canada, that I provided to you, which everybody agrees is the best methodology." So when he says that, he's saying both sides. The EPA is agreeing, and also the petitioners, right? Plaintiffs. Everybody agrees, which includes the EPA, that these were rigorous studies, and everybody agrees that these studies would be part of the best available scientific evidence. So this is huge because he's saying that the EPA is agreeing to this, and at the time of the petition, those studies weren't available. Hence why he is making sure that they go back and review with these new studies, that he wants the EPA to look at the petition again, and he wants to see their answer on what they're going to do. So he says the EPA He also kind of reprimanded them. He says the EPA appears to have applied a standard of causation, which from my read of TSCR is not accurate. It's not a proper allocation. It's not the proper standard. Why is that not the proper standard? Because under TSCA, you only have to find an unreasonable risk for them to do something. You can find unreasonable risk without finding causation. So you don't have to find that fluoride causes, neurotoxic damage and lowered IQ and causes that. You just have to find that it poses an unreasonable risk to that. So here from the court records, because there is serious evidence here, there is no doubt that these two studies from Canada and Mexico raise serious questions. Now, before I get to, I think it's my last slide. Yeah, before I get to my last slide, I just want to say why it's important is because the judge could have ruled. The judge had the power to make a ruling that would have either probably had the EPA, if he ruled in favor of the plaintiffs, it would have made the EPA they would have been duty bound to eliminate the risk and the risk of fluoride's effect on pregnant women through water. So they would have had to, the most reasonable way to do that would be to end water fluoridation. That's a huge thing. He did not do that. And he could have ruled in favor of the EPA and said, nope, this does not cause an unreasonable risk. He didn't do either of those things. He identified that everybody agreed that the best science was available after the 2016 petition, and that's the science that I've been providing to you. And it's good. Now we're able to see the EPA also saying this is the best science. So that's why the judge has done something unusual, where he's putting it back to the party, saying, we know the serious evidence here.
Brian, we really need to wrap this up very soon.
Okay, one more slide. So the email that I sent you talks about the draft National Toxicity Program monograph on the systematic review of fluoride exposure, neurodevelopment, and cognitive health effects. So this is ongoing for several years too. And it actually made it through a second draft. The National Academy of Sciences did a peer review, and it made it through the one peer review. And this is a conclusion in the draft. I want to be clear, this is not the final conclusion yet. This is a conclusion in a draft, but it did make it through peer review, a series of peer review already. And what's important is the underlying statement. However, when considering all the evidence, including studies with exposures to fluoride levels higher than 1.5 milligram per liter in water, which is 1.5 part per million, we fluoridate at 0.7 and used to fluoridate at 1. NTP concludes that fluoride is presumed to be a cognitive neurodevelopment hazard to humans. This conclusion is based on a moderate level of evidence that shows a consistent and robust pattern of findings in human studies across several different populations, demonstrating that higher fluoride exposure, greater than 1.5 milligrams per liter in drinking water, is associated with lower IQ and other cognitive effects in children. And the reason I wanted to put this here is that this is the NTP, and this has already gone through some peer review. So the question of it's if it's a cognitive neurodevelopment hazard of humans right now, in its draft form, the NTP is including that in draft form, and also making reference to lower IQ and cognitive effects of children. So I just wanted to, hopefully that's resonating with you, that this is not just a, off to the side, I'm giving you the best available information. Actually, the trial is still open because the judge wants to see this NTP monograph included in, what they're talking about as well. He wants to see that before he makes his decision. So my final statement will be that the former director of NTP has come out with another researcher who the EPA has used for their lead standards, and published this op-ed that it's time to protect kids' developing brains from fluoride. Mounting evidence suggests fluoride may be hampering brain development and reducing kids' IQ. The U.S. needs to rethink the exposure for pregnant women and children. This is by a decade-long head of the NTP, which is under the NIH. And I did forward you the current NIH director's retirement statement on Linda Birnbaum, which praised her of her service and her and the work that she did while she was the director. And so that's why I'm hoping that you also consider that we rethink this exposure to pregnant women and children. I'm actually, let's see how I shut off presenting. Oh, stop sharing. And so my ask to you is that with all this new information, my plans are to bring this to, town meeting. Town meeting is the ones that put it in the water, and it seems that all the boards agree the ones that are would be to take it out. But in the past, the Board of Health has been advisory. Everybody's looking to the Board of Health, right? In the past, so many times, the Board of Health has provided information, of course, from these agencies saying that it's safe and effective and not to worry. So the town meeting members are not concerned because they're hearing that the Board of Health tell them that there's nothing to worry about, right? There's no Board of Selectmen saying there's no evidence of any harm, no studies that show any evidence of any harm. And so what I'm hoping is that, because only town meeting can take it out, is that when you do have your, that you will consider this, and when you do have your say in this matter, that I hope you address this, because these are now fact and court records, right? So that it's not just, it's safe and effective, and to ignore the underlying science that's there, since this is a town issue. And I hope you ask me questions, because I've been doing this for a long time. Thank you very much.
Thank you, Brian. Are there any questions? I guess there aren't any questions. I think at this point in time, I mean, I'm still not in a position to, have a local Board of Health issue a statement or a warning. I think, again, this needs to be handled through the town meeting process, and when that time comes, then we can address it further then.
Chair, I do have a question.
Mr. Chair,
Yes.
Ms. Fishman has a question.
So Brian, would your intention be to share some of this information publicly before town meeting?
Yeah, well, because throughout this, process for the last 5 or 6 years through the town meeting has been getting advisory information that it's safe and effective, and that there are no studies that show any harm. That I do believe that actually the Board of Health and Board of Selectmen, who are the water commissioners and have some oversight responsibility, because town meeting gave them the money, right, the funds to do this. These boards have gone on record at town meetings and their own board meetings saying that there's no issue, right? And when new information comes up, neither boards are providing the information to town meeting. So town meeting is still under the impression that they're safe and effective and no issue. But as you can see, there's a lot of information here that would be relevant to town meeting members that isn't being told to them. It's not, and fair enough, it's not being told to you, I would assume. I don't know if any of the board members are aware of any of this information. So I don't think the CDC is actively pushing, or EPA is pushing this down so that it gets to Mass Department of Public Health, and they're probably not telling you this information. But in the end, if you're telling the town meeting, then you share the responsibility. So that's why my intention ideally would be that you would take this information, maybe check back with these other boards, other regulatory agencies, whether it be Mass Department of Public Health, etc., and then share this information out, whether it be to the town meeting or to the public, because now you can't say you didn't know, right? And that's why it's important that you get a chance to either not, set the record straight, but at least update the record, right? So as I don't think town meeting members, if they knew all of this, are going to, how are they going to react if they know that nobody's telling them this? I don't know. So that's kind of my feeling. So I would hope that you would take action before town meeting and provide some information out. But if that's not the case, then I would hope that during town meeting that you acknowledge some of these things as fact, and it's not just the same, science by proclamation that may be coming down from regulatory boards, at different levels of government, right? That it's safe and effective. So that's my intention.
Thank you, Brian.
Welcome.
Dr. Abraham, did you have a question?
No, Mr. Chair, no further questions. Appreciate the members' informative presentation.
Thank you.
Okay, so at this point in time, we're just going to leave it at this, board members.
I second that sentiment, Mr. Chair.
Okay, well, thank you, Brian, for coming on today.
Great, thanks. Is there any plan for next meeting to discuss by the board? Just a question, so I know the next, if there's any next discussions.
Only if you're planning on submitting a petition for town meeting and you want it to come before us again, we would consider it then.
Okay, so just so I understand this, so that the Board of Health will take no action based on this information unless I bring something forward to the Board of Health again, if whether it be a petition or some other request.
That's my position.
Mine too.
Okay.
I intend to look further into this and maybe kind of follow up with the CDC and NIH.
Okay. Well, thank you very much. Let's move on to the next agenda item. Review and discuss coronavirus COVID-19 update. Do we have Julie on?
Yep, I am here. So the Central Mass Regional Public Health Alliance has been continuously working with the general public as well as fielding complaints and concerns, and again, providing guidance throughout the local businesses. We have been investigating positive cases, continuing with contact tracing, as well as still working at the emergency dispensing site at the Worcester Senior Center. And currently it's still operating, and the fate of the site is still undetermined. We are waiting to find out more information from DPH. I know that Karen did send out an invite or an email for a WebEx this afternoon between 12 and 1 to discuss any of the updates with the current status, again, with the Worcester Senior Center and the Alliance vaccination sites, as well as the process for ordering vaccines, for the mobile clinics for shut-ins and those who live in senior and low-income housing. I know that Dr. Castile will be on that call today, providing information what she has been doing with the mobile clinics, as well as Dr. Hirsch will be speaking about how the Regional Public Health Alliance can support and organize mobile teams. And one thing that they're really asking for is they're looking for medical and non-medical volunteers to assist with it. And that's scheduled again today between 12 and 1, and we hope that you are able to join. Also, as we know, Governor Baker's press release, I believe it was February 25th, has provided new guidance out. We are now in phase 3, step 2, which is effective on Monday, March 1st. And this is regarding indoor performance venues, theaters, open at 50% capacity with a maximum of 500 people. Indoor recreational activities like laser tag, roller skating, trampoline parks, obstacle courses, they're open up at 50%. Updated capacity limits, again, that will be put into effect on March 1st. They'll be able to, these businesses will be able to increase their capacity to 50%. I'll just name a few of them. Any close contact personal services, libraries, office spaces, places of worship, theaters, laboratory manufacturing, construction. Additional guidance changes also that restaurants will no longer have a percentage seated capacity limit, that they just need to abide by the required 6 foot between each table. They are allowed to have musical performances in restaurants with the appropriate distancing. It's still the 90-minute time limit on tables, and no more than 6 people per table. Any food courts that are still, they're still to remain closed at this time. And we know further down the line on March 22nd, according, subject to the public health data, that the gathering limits will increase for different event venues as well as in public settings. And this would be 100 indoors, 150 outdoors, For private setting, for private residents, it's 10 indoor and 25 outdoor. And later on, phase 4, step 1, again, March 22nd, it's subject to change. They have a whole, they still have their phased approach. The one key piece is that overnight camps will be allowed to open for the summer in 2021. And again, our group is public health nurses are continuously, following up again with, as well as Micah and myself and our team, with the businesses in the communities that do have positive cases. And again, we're helping them identify close contacts and providing guidance on site as well. Thank you.
Okay, thank you, Julie, very much for that update. Are there any questions for Julie from the board?
No.
Questions?
Okay, thank you again, Julie, very much for that update. The next item is to review and act on the report from the Central Massachusetts Regional Public Health Alliance.
Good morning. So for this past month, we did a total of 66 inspections. 40 of those were food. Only about 12 of those were COVID-related complaints. So it seems to be going down, probably about half as many complaints as the previous month. And most of those complaints are related to contacting a business that may have had a positive case or some other issue with social distancing or masking still.
Okay, well, thank you, Micah. Any questions from the board?
No questions.
No questions.
Okay, very good. Thank you very much. So we will move on to the next item, which is to review our meeting schedule. For the next meeting.
Is March 19th an option, Mr. Chair?
Let's see, March 19th.
Correct.
I could do that. Yeah, Jenny.
Just checking. Hold on. Yes, that would work.
Okay, I'm okay with that. So let's plan on that.
Okay, appreciate the accommodation.
Sure, you're welcome, Dr. Abraham. Okay, if there's nothing else from the board, do we have a motion to adjourn?
So moved.
I second.
Okay, all in favor signify by saying aye. Jenny Fishman,
Aye.
Dr. Abraham,
Aye.
Steve Vigent, aye. So the meeting is now adjourned. Thank you very much, everybody.
Thank you.
Thank you all very much. Have a great day.
Have a great weekend. Bye.